Module 12, Medications and Drug Abuse. The effects and side effects of medications may interfere with safe driving. The driver may experience an altered state of alertness, attention, or even temporary confusion. Other medications may cause physical symptoms such as hypotension, sedation, or increased bleeding that can interfere with task performance or put the driver at risk for gradual or sudden incapacitation. Combinations of medications and/or supplements may have synergistic effects that potentiate side effects, causing gradual or sudden incapacitation. According to the FMCSA advisory criteria, you are instructed to discuss common prescriptions and over-the-counter medications relative to the side effects and hazards of these medications while driving. In addition, educate the driver to read warning labels on all medications. The driver completes the health history section on the medical examination report form. You must review and discuss with the driver any yes and not sure answers. Does the driver take any prescribed, over-the-counter, supplements, or herbal remedies for the conditions marked? Evaluate whether the medication has any side effects that interfere with safe driving. Consider if the medication indicates the presence of an underlying disqualifying disease or injury, and if the medication is effectively treating the medical condition. Considerations for the medical examiner when making a physical qualification determination should include, but may not be limited to, the following. What is the underlying condition for which the medication is being prescribed? Medications are commonly used off-label to treat a myriad of disorders. Are side effects present that will adversely affect the individual's ability to safely operate a commercial motor vehicle? Has treatment with a scheduled substance been shown to be adequate, effective, safe, and stable? Consider if the medication interacts with other drugs, foods, or alcohol, interfering with the ability to drive. Consider if the medication has side effects that interfere with lifestyle functions such that the driver may cease to comply with treatment, for example, a decreased libido. If the medication requires monitoring to maintain a therapeutic dose or prevent toxicity, for example, Coumadin. Does the individual have signs of drug abuse such as tremors, needle track marks, or multiple skin eruptions? Ensure the driver understands and complies with the medication plan, including monitoring, knows what warning signs might indicate medication toxicity, stores medications properly when driving long haul or cross country, reads and understands warning labels on medications and supplements, consults the treating healthcare professional or a pharmacist before using new medications or combining medications while driving. Federal law prohibits Schedule I drugs or substances from being prescribed for any purpose. Therefore, a medical examiner cannot physically qualify an individual who uses Schedule I drugs or substances. A medical examiner may physically qualify an individual who uses an amphetamine, a narcotic, or other prescribed drugs or substances listed on Schedules 2 through 5 if the prescription exception is met. In order to meet the prescription exception, the following 3 criteria must be true. The medication is prescribed by a licensed medical practitioner who is licensed under applicable federal, state, local, or foreign laws to prescribe controlled drugs and substances. The provider is familiar with the individual's medical history. The provider has advised the individual that the drug or substance will not adversely affect the individual's ability to safely operate a commercial motor vehicle. One of the ways for the medical examiner to obtain the information that shows the prescription exception is satisfied is to request a written communication from the prescribing licensed medical practitioner who satisfies the regulation's requirements. The commercial motor vehicle driver medication form may be used, with the driver's consent, as an optional tool to obtain the required information. Again, use of this form is optional. Controlled substances are divided into Schedules 1, 2, 3, 4, and 5. The drug schedules are based on addiction potential and medical use, but not side effects. Therefore, a drug can have little risk for addiction and abuse, but may have side effects that could adversely affect the individual's ability to safely operate a commercial motor vehicle. The schedule lists are updated annually. Schedule I drugs have no currently accepted medical use in the United States and have a high abuse potential and are not considered safe, even under medical supervision. Heroin and marijuana are examples of Schedule I drugs. As previously noted, the prescription exception criteria do not apply to any Schedule I substance. Schedule II drugs have currently accepted medical uses but have a high abuse potential that may lead to severe psychological or physical dependence. Schedule II drugs include opioids, depressants, and amphetamines. The opioids in Schedule II include natural opioids, for example morphine, and synthetic opioids, for example oxycodone. Although the FMCSA had previously stated that methadone is disqualifying, in the 2024 advisory criteria, the FMCSA notes that methadone use does not automatically preclude medical certification for operating a commercial motor vehicle. The FMCSA relies on the medical examiner to evaluate and determine whether an individual treated with methadone should be issued a medical examiner certificate. The examiner must have information that the prescribing licensed medical practitioner who is familiar with the individual's health history has advised that the treatment with methadone will not adversely affect the individual's ability to safely operate a commercial motor vehicle. Final medical certification determination, however, rests with the medical examiner who is familiar with the duties, responsibilities, and physical and mental demands of commercial motor vehicle driving and non-driving tasks. It would be fair to say, however, that in most instances, an examiner will not certify a driver taking methadone. Schedules 3, 4, and 5 drugs have decreasing potential for abuse compared to the drugs included in preceding schedules. Abuse may lead to moderate or low physical dependence or high psychological dependence. Schedule 3 drugs include bodybuilding steroids and Furoset with codeine. Schedule 4 drugs include Ambien, benzodiazepines, chloral hydrate, and phenobarbital. Schedule 5 drugs have the lowest potential for abuse and include Lomotil and many cough medications. In the 2024 advisory criteria, the FMCSA notes that treatment with Suboxone, a Schedule 3 drug, and other drugs that contain buprenorphine and naloxone do not automatically preclude medical certification for operating a commercial motor vehicle. As discussed, federal law prohibits Schedule I drugs or substances from being prescribed for any purpose, and therefore drivers using a Schedule I drug cannot be certified under any circumstances. Marijuana is a Schedule I drug. Federal law lists marijuana, including marijuana extracts containing greater than 0.3% THC, as Schedule I drugs. An individual who uses marijuana cannot be physically qualified even if marijuana is legal in the state where the individual resides for recreational, medicinal, or religious use. The FDA does not currently determine or certify the levels of THC in products, so there's no federal oversight to ensure that the labels on CBD products that claim to contain less than 0.3% THC are accurate. Therefore, individuals who use these products are doing so at their own risk. CBD products containing less than 0.3% of THC are not considered a Schedule I substance. Therefore, their use by an individual is not grounds to automatically preclude physical qualification of the driver. The medical examiner may request a non-DOT drug test to aid in the physical qualification determination, including when signs exist indicating the individual may not have disclosed use of a scheduled drug or substance. Non-DOT drug tests may be a helpful tool to determine whether an individual is using a prohibited substance, such as a CBD product that contains more than 0.3% THC. Questions 31 and 32 on the medical examination report form relate to illegal drug use. These two questions are not intended to involve the medical examiner in the application and administration of the DOT drug and alcohol testing requirements explained in the previous module. Disclosure of prior illegal drug use does not preclude an individual from being medically certified. The Federal Motor Carrier Safety Regulations do not include a mandatory waiting time prior to medical certification after known or disclosed illegal drug use. If a medical examiner has concerns about an individual's illegal drug use, the examiner may decline to issue a medical examiner certificate until the examiner's concerns are satisfied through documentation from an appropriate drug use assessment, a treatment program, drug testing, and/or counseling. The FMCSA emphasizes that examiners are not prohibited from requesting a non-DOT drug test on individuals who disclose recent or past illegal drug use during the physical qualification examination process. With respect to commercial drivers, DOT-regulated drug and alcohol testing is only applicable to drivers who hold a commercial driver's license or commercial learner's permit. This separate testing is not part of the physical qualification examination. It is noted that DOT-regulated drug and alcohol testing for pre-employment or other authorized purposes may be conducted concurrently with the physical qualification examination. As discussed in the previous module, drug testing is not a required part of the DOT exam. However, medical examiners are not prohibited from conducting a non-DOT drug or alcohol test as part of the medical certification process to assist in making a proper qualification determination. A positive non-DOT drug or alcohol test does not require the use of a certified substance abuse professional. As discussed in the previous module, DOT-mandated drug testing is governed by Regulation 49 CFR 382. Again, to clarify, DOT drug testing is completely separate from the DOT exam performed by the medical examiner, which may include a non-DOT drug test at the examiner's discretion. The main difference is that a positive DOT drug test is reported to the FMCSA clearinghouse and requires involvement of a substance abuse professional. Certainly, if an examiner orders a non-DOT drug test to evaluate for substance abuse and the test returns positive, the examiner certainly has the option of requiring involvement of a professional qualified to render an opinion regarding the presence of a substance abuse disorder. Regulation 49 CFR 382, which implements DOT drug and alcohol testing procedures, is designed to help prevent crashes and injuries resulting from the misuse of alcohol or use of controlled substances by drivers of commercial motor vehicles. So, who must be tested under this regulation? That is, who must undergo a DOT drug test? All drivers, including part-time, holding a CDL and operating commercial motor vehicles on the public roadways, must be U.S. DOT drug and alcohol tested. This means any driver required to possess a CDL, including drivers employed by federal, state, and local government agencies, owner-operators, equivalently licensed drivers from foreign countries, for-hire motor carriers. All federal DOT-regulated drug test results are reviewed and interpreted by a physician who is certified as a medical review officer. When there is a positive result, the MRO contacts the driver and conducts an interview to determine if there is an alternative medical explanation for finding drugs in the urine specimen. The MRO notifies the employer only after determining that a positive test result was caused by unauthorized use of a controlled substance. All DOT drug test urine specimens are tested for marijuana, cocaine, amphetamines, opiates, PCP. A driver must be removed from safety-sensitive duty when the driver has a positive DOT drug test result caused by the unauthorized use of a controlled substance. To be returned to safety-sensitive duties, the driver must be evaluated by a substance abuse professional, comply with recommended rehabilitation, have a negative result on a return-to-duty drug test. This ends Module 12.